heroes who are working day and night to help get us through this pandemic. As you've seen, our inpatient numbers are continuing to drop. They've dropped every day now for the past week, which is certainly good news. Currently, we have 394 patients with COVID in the hospital. 85 of those are in the intensive care unit and 70 are on ventilators, which is still a significant number. And as you know, those patients will have a poor prognosis, unfortunately. Yesterday we admitted 29 patients, which is a low number compared to what we had been seeing, and we discharged 63, and that really has contributed to the drop in our inpatient census. So that's all very, very, very good news. Since the beginning of the pandemic, we've lost 1,056 patients, including 7 yesterday, and certainly our hearts go out to those families that lost their loved ones due to this terrible virus. At Golisano, we're treating 8 children with COVID. As you know, earlier in the surge, we usually had 1 or 2, so we still have a significant number of children that we're treating. We're still facing significant capacity challenges. We're at 95% capacity system-wide, and our ICUs are at 96% capacity. So I want everyone just to continue to do whatever they can to slow down the spread of this virus. The things we've been talking about from the beginning, masking, social distancing, hand washing, all those things really do make a difference. I wanted to take a moment to address the vaccine mandate. As you know, President Biden has mandated vaccines for all employers of more than 100 employees, and certainly all healthcare providers that receive Medicaid and Medicare funding. We would qualify under both of those. So we are waiting for further clarification from the government on how that's going to be done. There's going to be a public opinion piece of this, and then there'll be rulemaking, and once the rules are made, we will work with our teams to follow whatever the guidelines say as that comes down the pike. I also wanted to take a moment to thank our community for the incredible support that we've seen over these past few months. The signs, the masks, the food that's been delivered. The work for our healthcare heroes has truly been incredible. Our own foundation has set up a Help Our Heroes fund, and we've collected over $100,000 in that fund. And those dollars are going to help support our staff both physically and emotionally through this pandemic. So I just want everyone to be aware of that, and if you want some more information, you can go to www.leehealthfoundation.org/helpourheroes. So I would encourage everyone to do that. We certainly are grateful for everyone's support. At this point, I'd like to introduce Dr. Stephanie Stovall, Pediatric Infectious Disease Specialist and our Chief of Quality and Safety here at Lee Health. Stephanie?
Thank you, Dr. Antonucci, and thank you all for coming today. I feel like we're all one big family since we see each other every week. So thank you for coming, continuing to listen to us and your support. Wanted to just reiterate today the importance of children and vaccines. Children ages 12 through 17 are eligible for the Pfizer vaccine, and they should receive it. If you haven't gotten your child vaccinated, you should. There's more and more data coming out showing that vaccines do prevent hospitalization, they do prevent death. That even applies to our 12 to 17-year-olds and is vitally important. We are taking care of your 12 to 17-year-olds who are vaccine eligible, and we urge you to go get them vaccinated as soon as you can. There are a couple of ways to do that. Our Gulf Coast Clinic is open, so any 12 to 17-year-old that needs to be vaccinated, or anybody else for that matter who's eligible, can go there Tuesdays, Wednesdays, and Fridays, 7 to 3:30. They take walk-ins, they take appointments, and we urge you to use that service. The other service that we have is the Golisano Mobile Clinic. So leehealth.org has a list of the places where they go. They're going throughout our communities. They are setting up shop. A nurse administers the vaccine. They use a pain ease spray, which eases that needle discomfort for our younger kids or kids who have concerns about the pain associated with the needle. They will also vaccinate adults, so if you happen to catch them, you can certainly go up even if you're not a child. They're also staffed with a pharmacist who helps with the medication, a paramedic or an EMT, and a specialist who helps get you registered for your follow-up vaccine as well. So they're staffed, they're moving around. Please find them, whatever's convenient for you. And then, of course, Gulf Coast is available as well. So I wanted to take this minute just to remind you, kids are eligible. We're hopeful that will change and we'll have even more kids eligible before long, but that still remains to be seen. We'll keep you posted as soon as we know, because we will be vaccinating younger kids once we're able to do so. And thank you again for the support. It is felt, it is appreciated, and we thank you for your time today. I'd like to introduce Jennifer Higgins. She's our Chief Nursing Officer. She's going to talk to you a little bit about COVID from the eyes of a nurse.
Thank you, Dr. Stovall. As Lee Health's Chief Nursing Officer, I'm here today to represent all of our amazing nurses and our bedside care team staff, and just talk a little bit about the reason why they come to work every day. They'll tell us they're here to serve the community, that their mission is to make certain that they can make a difference. And what we're experiencing right now is the emotional toll and the mental toll that it's taking on our team members. So although the numbers are coming down, I don't want you to think that that means that these patients are any easier to deal with, or that the mental toll doesn't continue. We still have high volumes within all of our hospitals as far as over the capacity. I know Dr. Antonucci talked about that. We have a lot of patients that are here for a long length of stay who continue to battle this disease, and it's very difficult as the days go on for both family members and the care team members to continue to navigate and make certain that the family members are being kept informed and that the patients feel like they're getting what they need. Sometimes this is a very slow process. Some of the patients may be fine one day or seem to be improving, but then begin to deteriorate very quickly and may end up on a ventilator the next day in the ICU. And these communications that we're having, even with the numbers going down, we're still having lots of communications, conversations around end-of-life care. These are very difficult conversations with family members and the care team. They try very hard to explain the whole continuum of care and all the things that we've tried to do to improve the patient's outcome. But sometimes that's not something that we can do. And unfortunately, these conversations continue to take a huge mental toll, both on our care team members, nurses, and staff all across the health system. So these are people. These numbers are people. They're our community members. They're our neighbors. They're that person that you were in your neighborhood last week walking your dog with that person. That could be somebody that's on a ventilator now in one of our hospitals. It's very real to young and old alike. So this is why I urge you to please get vaccinated for COVID-19. Wear your mask, and vaccines do save lives. I do again want to thank the community members, all of the foundation members, all of the businesses who have written letters. Many patients that have been discharged have written beautiful letters. That means so much to our care team, the words of encouragement, the treats, the meals, the food, all of the deliveries, all of the things that continue to lift us up and really help us through this challenging time. So just want to thank you.
All right, we haven't taken any questions that anyone has.
As far as a vaccine mandate, what will that timeline look like as far as implementing one?
It really depends on the rulemaking we get from the federal government. They're going to have to come up with the rules, and I'm sure they will set the timeline. And will let us know at what point everyone needs to either be vaccinated or begin weekly testing, et cetera. So we're waiting for those details. We don't know at this point. Yes?
In terms of a Labor Day spike, would we be seeing any early indication of that yet, or is it too soon to tell?
It's probably a little too soon to tell. I would anticipate that we would see that, 7 to 10 days?
Yeah, end of this week.
Yeah, by the end of this week. So, as I said, the number of patients admitted with COVID yesterday was lower than we've seen. So, if we start seeing that creep up back in the 40, 50, 60, 70 range, that would be a sign that we're seeing that spike. Yeah.
What would you say the biggest challenge you guys are still facing is?
I think, as Jennifer mentioned, the capacity challenges, and especially in the ICU. When you have 70 patients on ventilators with COVID, that's a tremendous toll it takes on you, not only physically but emotionally. to see these patients. And you only have to walk through the ICU room after room after room and see this, and it has an impact on you. So I think that's the biggest issue that we're grappling with.
As the numbers continue to go down, are you still feeling like resources, and you kind of mentioned it a second ago, but resources, space, and personnel are very strained still, or has that gotten better?
Well, it's gotten better. As you know, we were up over 100% capacity just a few days ago. So it is getting better with our total capacity, but it's still a much higher capacity than we would normally see this time of year.
Do you have a number of percentage of folks on the ventilator who come off alive?
That's a great question. I don't know if Stephanie, if you would have that. Once someone gets on a ventilator with COVID, what their survival is.
That's very patient dependent. If it depends upon the age of the patient, underlying conditions. The ones who have the most underlying conditions are very unlikely to successfully wean from the ventilator. And so we don't have an exact percentage or an exact number because it is very patient specific.
Are unvaccinated people less likely to come off?
Yes, from the standpoint that it's extremely rare to see a vaccinated person ever put on the ventilator. Most of our vaccinated individuals in this community are not winding up in the hospital, and if they are, they aren't in the ICU, much less on a ventilator. So from that standpoint, there's not a good comparison to make because there simply aren't enough vaccinated people who wind up that severe.
Well, thank you again for being here. You've played a tremendous role in our ability to communicate what's happening, and we do sincerely appreciate that. Thank you.